Hi, my name is Dávid Tornai. I'm from Debrecen, Hungary, and I'm working at the University of Debrecen at the Department of Gastroenterology.
Hello, my name is Marco Corignac and I'm the president of European Liver Patient Association. It's really nice to have you here. So can you explain us a little more about the research that you're doing?
Thank you for having me here. Yes, so the main idea is that the gut forms a physical and an immunological barrier between the body and the environment. And all the blood that is collected in the intestinal tract goes to the liver. So therefore, there is this thing called the gut-liver axis. And so during cirrhosis, which is the end stage of chronic liver diseases of different etiologies, the gut barrier gets like injured or its function gets worsened. So more and more bacteria can enter the system, and this can affect the liver disease itself. It can play a role in the progression of the liver disease. And in the gut, the majority of antibody producing cells engage towards immunoglobulin A production, which is a certain type of antibodies. So immunoglobulin A is the main antibody in the intestinal tract. It has been shown that in chronic liver diseases, total immunoglobulin A level or concentration was increased, and also the level of secretory immunoglobulin A, which is very interesting because secretory immunoglobulin is the one that was already secreted to the intestinal lumen and then with an unknown mechanism got back to the system. But yeah, and also there are like target specific antibodies that have been shown to have association with disease progression in either liver or intestinal diseases, but little is known about the role of these antibodies in the context of acute decompensation of cirrhosis.
So you try to measure how many they are or try to figure out what their role is? What exactly are you trying to do with them?
Yeah, we try to do both. Like we try to first we measure the concentration of total immunoglobulins and also these specific immunoglobulins that they have a specific target. And then we correlated their concentration with each other, with disease severity, and we also try to assess whether they are associated with outcomes like disease progression or mortality.
How do you measure that? Take blood or you take stool
Yes,
sample or how do you?
you can do both. We only measured serum samples. Serum is basically the fluid that is between the blood cells. So the blood cells are removed, and what which remains, that's the serum.
And with that research, can you see what will be beneficial for patients at the end of the research when you get the positive results and you are confident that you can say that this influence like the cirrhosis and the understanding of the system? What would be the benefit for the patients?
For the patients, the benefit is that if they are correlating with mortality, and secretary IgA actually showed a very high association with mortality in the more severe patients with acute-on-chronic liver failure, then even among these high-risk patients, we can identify the ones in the highest risk. And yeah, we can make further steps in time.
So then the healthcare will change for people that you can foresee that they will have like more complications.
Hopefully, yes.
So it's like a path to better care for like very severe ill patients that have like acute or chronic liver
Yes,
death.
I mean, our study has also a mechanistic part, and hopefully it can, open roads to better treatments, but we can also like stratify these patients better and identify patients who are the most vulnerable, and yeah, they can receive the best care in time that's available currently.
So when you look at your research and where you are now, so what are some of the next steps that you need to do?
Right now, the number of patients of these most severe patients was kind of low because the whole population was like a good size, but the most severe patients were like, that was just a smaller part within the whole. So other studies should like validate our results. And if it can be validated, then further steps can be done to enter the clinical practice.
Thank you very much.
Thank you.